Do welcome everybody. Sea of Pregnant Bellies here today. Do we have women that are going to be mums for the first time here today? Show of hands. How exciting. I was actually sitting in your shoes only a few months ago. My little one is 20 weeks old. So when I talk to you today about trying to get back to physical activity, getting back to activities of daily living and getting back to fitness, not only am I talking to you as a clinician, but a new mum for the first time myself. I do understand the challenges involved, and that's why one part of my little talk today is going to be about finding the time to get back to doing some exercise as well. So welcome again. Thank you for taking the time out of your day to sit in. Enjoy. If you do have questions along the way, please hold on to them just until the very, very end. And if we do have time, we'll address those individual questions. If we don't, I'm wandering around afterwards. So please feel free to just come and drag me aside, and I'm happy to help you out as best as I can. So we're going to be discussing four main areas today: rebuilding core strength, improving flexibility, managing incontinence, which can be one of those sort of touchy, sensitive type issues, and finding the time to exercise. The overall theme that we do want to address though is that as mums, we need to look after ourselves. We need to look after ourselves in order to look after bubs. So these four key areas I think will really, really help you ladies on your way once you have that little bub at home. So first of all, rebuilding core strength. Have we heard of the term core strength before? Yes? Lots of people tend to hear about this term. Do we know what it means? No. That's what we usually find as well. So when we're looking at core strength, we're really looking at a terminology called stability in there. And we're looking at stability of the muscles wrapping around our spine. We need stability in order to keep our back nice and safe while we're moving through our pregnancy, and while we're also performing our activities of daily living and looking after bubs when we get home as well. Now I've brought my little skeleton here today. So this is the front of my skeleton. If I'm looking at the front of the skeleton here, it's like looking at the front of me, okay? If I turn the skeleton around, all your little bumpy bits here, they're your little bumpy bits on your back. Okay, so we usually have a bit of a feel in there, so we're orientated. When we're talking about core stability, we're looking at three main muscle groups in there. So we're looking at our deep abdominal muscles that sit on the front. We're looking at our spinal muscles, deep spinal muscles that sit around our back. And we're also looking at a third group called our pelvic floor muscles. Our pelvic floor muscles sit under here. Now, when we're looking at core stability and abdominal muscles, the myth out there is that our core stability muscles are our six-pack muscles. Have you heard of that before, or did you just sort of think that was the case? I'm getting a few nods. The six-pack muscles are called our rectus abdominis muscles, and they're the muscles that are most superficial under your skin. Their primary responsibility is to help us do this during the day. They don't actually help us with stability around our spine. Deep to those muscles, we have our oblique muscles. Now, our oblique muscles is what we call our hands in our pocket muscles. So they run this way. They actually help us do this type of movement. Again, very, very good for movement, doesn't provide a lot of stability around our actual spine. Deep to those muscles, we've got our transverse abdominis muscles. It's those muscles that actually come around from the front and wrap into the back of the spine. So if we've got them around the front, they come in and insert into the back of the spine. They help give you stability. Without strong muscles there, we're going to be floppy. We're going to be doing this type of thing, which is certainly not good for your spine, not great for spinal health, and particularly if you've got pre-existing back issues prior to becoming pregnant as well. So we've got those transverse abdominis muscles, which play a really big role in core stabilization. Same sort of rules apply with our back muscles. Several layers of back muscles, most important being multifidus in there. If we've got strong muscles at the front, strong muscles at the back, and we've got our strong pelvic floor muscles, that's actually what we're wanting. So if somebody mentions the word core stability to you, you need to work on your core. We're not just thinking about those six-pack muscles, we're looking at all of those muscles around that area. Today we're going to be focusing a little bit more on pelvic floor. So we're going to have a few slides on those, and I'm actually going to be giving you a few little tips and tricks on how to activate those muscles as well. So your pelvic floor muscles, they tend to be the most important part of the core. They are, as I mentioned, found at the base of your pelvis. They start off quite firm, very tight, like a bit of a trampoline in there. As our little baby grows inside of us and gets bigger and bigger and bigger, because of the downward force moving through our pelvis, it tends to weigh down on those muscles a whole lot. And those muscles can actually become quite weak and quite lax in there. So even if you're having a cesarean birth, a lot of people tend to think with the cesarean, my pelvic floor muscles will be perfectly intact. Unfortunately, they won't be because we have had this downward force acting down on these muscles throughout our term of pregnancy. We've had a lot of weight moving through them, and we've actually had a lot of weakness and laxity moving through that area. So it's very, very important that we start with pelvic floor exercises very, very early. In fact, the earlier the better. Saying that though, it is never too late to get working on them. I know lots of mums that didn't do pelvic floor exercises throughout their pregnancy, sort of got to when Bubby was born and went, oh, I haven't done them. Is it a waste of time? Now, it's absolutely not a waste of time. It's never too late. It's just like training any muscle though. The earlier you do it, the better the outcome. So why do we need pelvic floor strength and stability? Certainly to support our bladder, our bowel and our uterus, to prevent back pain and to help us with bladder and bowel control. Current statistics in Australia actually suggest that about 1 in 3 women who have had a baby will experience incontinence throughout their lifetime. So it's very, very important that we work on these muscles again nice and early, just to reiterate that. Pelvic floor exercises certainly can help you recover quicker as well. Handling your new bub, basic manual handling principles. Do any of you have quite physical jobs at the moment? Even men in the audience, I'm going to ask you guys as well. Drilling, digging, picking up, moving, manual handling, isn't it? Guess what? Moving a bub around is manual handling as well. You've got this little load that you're picking up, you're lowering, you're moving, you're doing all these things with. It is manual handling. Please do remember that. So the 3 major principles that we look at when handling a bub as well is you want to keep your bub nice and close to you when you're moving and when you're going to lower them down. You want to move in nice and close to the object that you're lowering bub into or that you're picking bub up from, and you're wanting to get in low as well. So feet nice and wide apart or 1 foot in front of the other, getting low towards the object. Keep bub in as close as you can to you for as long as you can before you lower them down as well. So I'll use my little skeleton here. Bub's not going to be quite this size when it comes out, hopefully, but we don't want to be doing this type of thing. And I've seen parents do it as well. We want to actually keep bub in nice and close to us as long as we can before lowering down. Returning to exercise after giving birth. This tends to be an area where a lot of new mums get pretty anxious about. They don't want to do the wrong thing. They don't want to hurt themselves. There are 3 main time periods that we work with clinically with new mums. The first one being weeks 1 to week 6. What are the priority or the key areas to work on? It's actually 3 areas. It's your pelvic floor, lower abdominal muscle strengthening, and also your walking as well. So start walking as soon as you can. Pelvic floor muscles, you should be working them anyway throughout your pregnancy, but you want to get started on them as soon as you can. A few days after having bubs and you're in hospital, you'll more than likely get a physio coming around to your rooms. If we had mums in the audience that have had bubs before and been going through that? Yes, absolutely. Did you have a physio come around a few days? Yeah. Depending on the hospital, depends on how quickly the physio can often get to you. But when the physio does come around to you, please listen. Listen to what they say. Don't be scared to start working these muscles, and if you have questions, ask them. They're there to help answer your questions when they come in to see you. Week 6 to about 3 months, you can start doing things like water-based exercises, a little bit more cardiovascular type of activity, things like Pilates or yoga as well. Water exercise is actually really, really good. It promotes great joint range of motion, very, very good for cardiovascular fitness as well. Again, having gone through a pregnancy recently, I know in my last month or so, I hardly moved at all, which wasn't the best option when you think about the evidence behind that, but I was quite front heavy and I struggled to do cardiovascular exercise. So I was quite adamant in getting back to this stuff as soon as I can. I actually found that water-based exercise was fantastic for me. It actually helps promote that great cardiovascular exercise, but also strengthening and flexibility, which we're going to be talking about in a couple of minutes' time. 3 months onwards, you may look at considering returning to higher impact activities such as running. If you're a runner before pregnancy, you're probably pretty keen to get back to this. My personal suggestion, if you weren't highly active doing a lot of high impact activity prior to pregnancy, you don't want to be racing into this sort of stuff. We do have a little test called the pelvic floor stress test that you can actually do yourself to work out whether or not you're ready for high impact activity. And it's a 4-step test with 3 possible outcomes. So step 1 is you're actually going to drink 600 mils of water. Step 2, you're going to wait for 20 minutes. Step 3, you're actually going to do some jogging on the spot. Step 4, you're going to do 5 star jumps on the spot. Those last 2 star jumps, you're going to cough, you're going to sneeze, you're going to laugh, you're going to do something to increase that intra-abdominal pressure that's going to put force through your pelvic floor. That is the test in there. 3 possible outcomes. If you experience any leakage in there, you're not ready to get back to your high impact activities. If you don't experience leakage but sort of heaviness and firmness down below, you're almost ready but not quite to start back to this type of activity. If there is no leakage and no firmness, in most cases you're actually ready to go back into this type of activity. It's probably at this point though that you're still keeping in close contact with your GP and your obstetrician and going back for checks and lots of talking. I would always suggest that you run that past your specialist or your general practitioner. If you're currently seeing a physiotherapist or an exercise physiologist, run that past them as well. But at least it's a safe and simple little test that you can do to give you a bit of an idea on whether or not you're ready to actually go back to some high impact activities. How to work your pelvic floor. Lots of women try this and they work really, really hard at it and they get devastated when we actually test it and we say, unfortunately, you haven't been working the right muscles in there. So it's very, very important that you get proper coaching with this sort of stuff. There are actually some great workshops happening today in and around where you can actually get down with some clinicians and actually work those muscles. But some basic principles, the do's and the do nots. I often think the do nots are just important as the do's in there to know whether or not you're doing it well. You want to actually contract your pelvic floor by lifting and squeezing it inwards and upwards. It shouldn't be a huge hard contraction like you're picking up a weight in there. So if you picture where your pelvic floor is and you picture it almost hanging like a hammock, you want to pick that pelvic floor up. So you actually want to think about nice posture, sitting and picking it up almost like you're trying to avoid passing wind in there. You also want to think about trying to control your flow of urine at the same time. So when we're thinking about activating our pelvic floor, we're thinking about activating the core as a group. So working those front muscles, back muscles and pelvic floor, drawing the belly button in nice and tight if you can, and pulling up through those pelvic floor muscles. You want to fully relax in between each of your contractions. For correct exercise prescription and progressions and things like that, certainly recommend that you go to a good health professional. Don't just tighten your bottom muscles together. That's one of the big do nots. Don't just squeeze your legs together either. We work really, really hard and we try and do all these things and we get all these faces. We want to actually avoid doing those types of things in there. Abdominal strengthening, basics, getting on a mat and trying to activate is a great first step in there. We've got a couple of pictures here. We've actually got some handouts which we can distribute to you as well with some great exercises, but certainly starting on your back where we're gravity assisted to try and pull these muscles in and up is a great way to move. Then onto our tummies or onto a 4-point kneel where we're actually gravity resisted. Thera Bands, have we seen Thera Bands before? It's sort of stretchy based, yes, we've got some yeses in there. This sort of stuff is really user-friendly, effective, and it hardly takes up any room in your house. So in amongst all the clutter, when Bubs comes home and things are flying everywhere and you're trying to clean and all those types of things, this sort of stuff you can stick in a drawer. It's fantastic because it has a resistive type of element. So you can actually activate your core and go through a good series of exercises. Again, we'll distribute some handouts so you can have a bit of a look at that. But there are a couple of sample ones here. So standing up nice and tall, activating through your core, and actually moving some Thera Band on a diagonal. some lovely retraction-based exercises. General posture is really, really important as well. We're all sitting here at the moment, we're pretty relaxed, which is really nice. If you have a bit of a look around the room and have a look at everybody's posture, we're sort of a bit like this, which is very, very normal. Great posture means activation of the right muscle groups. So we're going to do a quick little workshop on the good posture. I'm going to get you to sit up nice and tall for me. If you've got anything in your hands, you're going to put it on the floor or pop it on your lap. And I'm going to get you to visualize your shoulder blade muscles for me. So have a bit of a wriggle of them if you need to. What I'd really love you to do is now try and squeeze those shoulder blade muscles in and down. So shoulder blades in and down. Wow. Does that feel different? Looking out here, we have a great group now. We're all sitting really upright. Good posture doesn't mean a straight back. Our spines are not straight, they're curved in there. A good posture does, though, mean activation of the right muscle groups. And if you're in a great posture, it also puts you in good stead for activating your pelvic floor and your core stabilizer muscles. See how long you can sit in that position for, and I'm going to check in at the end as well. How to achieve a flat tummy? Very, very common question. Bit of myth or fact in here. Do sit-ups help us achieve a flat tummy? Don't look at the screen for a second. Who thinks they do? Sit-ups help us achieve a flat tummy? Some, yes. I can tell you, evidence-based wise, the best way to try and achieve a flat tummy after having bubs is lots of cardiovascular activity. Okay, main reason being when we're cardiovascular active, we're getting in lots of oxygen into our body. Oxygen actually helps with fat metabolism. You can certainly do lots of sit-ups as well, which is going to help you tone the muscles underneath, but we want to make sure we're getting in enough cardiovascular activity at the same time. Improving flexibility is very, very important. Again, when we look at those handouts, there are some great exercises in there for you too. Stretching muscles is not only great for your body, it's very relaxing for you too. Managing incontinence, great resources available. Jump online to look at these things. There's also some great apps available for pelvic floor activities to remind you to do your pelvic floor also. Finding time to exercise. One piece of advice before you go today. Don't leave your exercise to the end of the day when everything else is done, because not everything else will be done by a certain time, okay? Cleaning, cooking, if you're working from home, looking after bubs, trying to organise the world around us, doesn't have a clock off time, okay? Biggest piece of advice, work it into current routines that you already have. While you're walking around here today, think of it as an opportunity to activate your pelvic floor, activate your core as well. When Bubs is on the ground playing, tummy time, fantastic time. Get on the floor with Bubs, get your Thera Band happening and get moving. Thank you very much for your time today. I know that was a lot of information in a short period of time. For more information about pelvic floor and core stability, I really recommend that you head along to one of the workshops today. Get someone one-on-one to work with you. Certainly seek the help of a health professional. And we've got these wonderful handouts here today with some examples of some great exercises. Enjoy the rest of your day.